will just say that the medical missions, like for example, our medical mission, since our inception, we have spent in excess of $500,000 US, contributing to the economy and the health care of the Jamaicans. We will continue to do that. We are forever growing. We take volunteers when we come. You can look us up. We have a website. We'll be coming the 4th to the 14th of September. And we have a huge health fair every year in Spanish Town in conjunction with the Spanish Town Police. So what we do is, we and the police, we form a coalition whereby we go to the prison oval. We have a huge fair. The police, one thing I forgot to mention, every site that we go, we feed everybody. Breakfast, lunch, and dinner, all right? And because we figure that people come with their hypoglycemic, they pass out, they come from the morning before, so people poor, so we feed everybody. Yeah. That's one of the things that is unique to us. And so we persuaded the police, who we are doing it in conjunction with in Spanish Town, to come out, bring their pots and pans, bring their stoves, coal stove and everything. So what we do is a huge elfie, we cook, actually the police cook, and then share, then play football, then play soccer, then play cricket with everybody in the community. That's what we do every single year. This is our third year that we're doing it. Okay. And so this year, we are anticipating seeing over about 1,200 people in Spanish Town alone. That's what we do. So we look for volunteers. The dates are the 4th to the 14th of September every year, always the first Wednesday. And I remember, we go all across the country in conjunction with the police and also with JUTC, who really help us to move around and stuff like that. Thanks for listening to me.
Encouraged to come to this conference because of the work that I've been doing in my corner of the universe. I'm Dr. Oliver Jones, and you might see on the program that I'm the group chair for the Source Energy Group. But you don't see that I'm also the founder of Center of Excellence at Hampton University, which I'm the senior economic professor there, and the department chair, which I've adopted into the program. Right? I am a Glenmurite. Proud Biennial, right? So I'm from the Clarendon man. As a matter of fact, I have an ongoing issue. Yes, an issue, right? I'm from Scotts Pass, Clarendon, right? Scotts Pass, Clarendon is not on the Jamaican map, at least not on the printed map. And so you can imagine the first time I brought my wife here, which I met in college in the United States, bragging about where I'm from, the greatest place on earth. And she this was before the whole GPS thing. She had to pull out the GPS, not the actual map. And she saw Clarendon Park, and I'm heading home. And she's like, "You're not on the map." That's not on the map. So therefore, you really do not exist because you're not on the map. And so ever since then, I basically made a mission of mine to get Scotts Pass on the map wherever I think possible, right? So that's part of the experience of what I do. Let me see this clicker. So what do I do? Let's first talk about the issues that I have at hand, so I can kind of roll it. I'll talk about some of my background and how I got here, what I'm doing, and so forth, right? But let's talk about disruptive ideas. Disruptive ideas. I hear about, as a matter of fact, Minister, I am pretty excited about the policy statement that you made and the space in which you're going. And I'll talk about the exposure of where I am, we are, and as a group, I recognize one diaspora already, but where I am today, there's several diaspora, Dr. Here, we got several people in the audience that keep calling me and say, I gotta get into this thing and come help to do this, right? So, kicking and screaming out here, right? But if you really want to talk about disruptive thought, let's start to talk about us diaspora And not all of us are here. Not all of us can even afford to be here. There's that aspect of the diaspora which is also is having as much challenge as Jamaican South. So when you look at this potential for this collaboration, disruptive thought number one I have is like, what if we have a diaspora member-owned preventive healthcare integrated network? USA, Canada, UK, Jamaica. Where we basically are enhancing that healthcare structure for all, right? Disruptive thought number two. What if Jamaica could develop an offering for the first time that's truly aligned with incentives around long-term behavioral change? Minister, I heard that, right? Disruptive thought number three. Could we design an approach that embraces pay-for performance and not a limited experiment that we keep doing, but as we start to develop this program, this is the basis for the entire insurance model, right? Again, we're talking disruptive thoughts. That's what we're here for, right? We're here just not to just talk about what we are, but we know what we want to do with this world-class approach that we're taking towards what the 2030 goals, right? Disruptive thought number four. Could our new approach be powered by mobile health, which is mHealth? So the devices, the stuff that we have in the structure, technologies, allowing greater insight into influence over patients' behaviors, driving costs through the system, right? Let's go. Disruptive thought number five. What if we make big data the central component of this new insurance offering? Creating a complete picture that has so far been missing to better understand the influence and risk. Disruptive thought number six. Could you develop a proposition, or could we develop it, that places the diaspora members, which are now the customers members, squarely at the center, using deep data to about customers to understand their needs, the deployment of this ML technology, and to build the relationship and guide for customer behaviors? Could our healthcare insurance find new sources of revenue to supplement the earnings, the gap that the minister mentioned? What if we see the pending IDB and USAID health system upgrade loans truly as an investment, where the system itself can actually pay back the loan? So now you have a system that is self-sustainable, and if we're talking about long-term viability, we're talking about a sustainable system, not something that we have to find money elsewhere to basically supplement, but the supplemental components of it are embedded into the whole model, right? If we can design that healthcare system with quality delivery care on par with or better really, than the United States, the UK, because I've been talking to some of my UK diaspora friends last night, and you know, the basic care have challenges, so that's not what we're talking about. We're talking about the best of the care there. Could we actually design a system that is, and being able to do that, right? Could we use the supply side economics to actually enhance this, look at it from economic health, environmental health, food for health, community prevention health? Minister, can you imagine if not only are we doing the food for development for our people, but we start leading that food export in that same area and basically driving change throughout the world in that space? Some of that revenue model could come back into a structural system that you're designing. So these are the disruptive thoughts that I'm wrestling with now that I've gotten into this game, which I've gotten pulled into. Personally, so I can basically tell you where I am and where I come from, my basis. Yeah, in 2006, I had like a midlife crisis, right? Very successful. I left from Biennial scholarship, Alkin scholarship overseas, Prairie View A&M, one of the Texas A&Ms in the system, academic scholarship, MBA, Syracuse University, great Syracuse. I headed the program. Corporate America, biggest global corporations working directly for CFOs and structuring companies with technology, all that stuff. Golfing on Fridays, country clubs and all that. But it felt kind of empty every time I'm coming back to Scotts Pass. And I'm basically getting, folks there are not experiencing or seeing a pathway on to experience what I'm experiencing. And so I started to say, okay, how am I going to actually do this? How am I going to actually, with my busy schedule, start to look at doing that know-how transfer back to that area where I'm from, right? And so I started by, looking at the different pieces. My mom, the educator, my dad, the outlet worker, who pushed me to be an entrepreneur. But how can I actually make this beneficial for, the community there? It's not my thing, for them there, right? So this journey started there. I also recognized when I started to do some of these big energy projects that I've done or worked on throughout the Caribbean, that we are not owners of our structure. We're not owners of the health, the energy systems. We're not owners of stuff. And so how do I actually get exposure to folks in those communities about the big things that are happening, the opportunities that they're missing out on, right? So I battle that kind of stuff, right? I recognize and admire some of the diaspora who are ahead of me in the game, who know big infrastructure, and I consult frequently with them how to actually do this, but Jamaica keep being on my mind. How am I going to frame this thing, right? I started with a foundation at the primary school at Scotts Pass Primary. We got some 40-foot AC containers to do like community resource center, but we need energy. Oh, we need computers, we need technology to actually do that. Okay, then that's when I encountered Miss Rose there years ago. Because I needed to find a place, people who are doing solar, people who are able to actually do a support me with a center that basically doesn't put more costs on the community, right? So then that basically drove into my looking at the region from where I am and my experience there, right? Which then led to, which I really want to get to some of these other sites, so let me flip along. Awards that I started to get from NASA. This NASA award, technology that I've been awarded this year, is NASA ranks it as its third most innovative award. Big data capacity to actually pull weather systems down, to look at the region, real-time data structures, modeling simulation, a delivery system that can be integrated with some of the great news I heard from the educational part last right? Augmented virtual reality being embedded in there. So now we're actually talking about things for the future. NASA just got awarded that in the last 3 months, right? They awarded systems able to do exabytes of data storage in Virginia to support that region. So we're talking about real stuff, solutions that are here that supports. But of course, Jamaica is a leader in the region, so it's really the region that you're talking about, right? Another NASA award, Heartbeat IT, to be able to integrate the stuff that we're doing before, right? So I have those the satellite for medicine structures that are there, small satellites that are coming to support the region. Early warning system, telemedication education that is there today. So these now are basically I'm offering to the table to start the conversation of what do I do with this that I basically went and completed to NASA to give towards the effort that we are talking about today, and how do we make it look so different that when we meet again in the next time, these are implemented. And so that's where I am today, and that's what I came, and that's what I'm about.
Excellent. Thank you very much, Dr. Jones. So we didn't achieve our objective of still an event, having started about 10 minutes, so 40 minutes late. So what I'm going to do as our contribution, this panel's contribution to helping to get the day back on track, is that I've agreed with Minister that we would have just done 15 minutes of Q&A, but I think I'm going to suggest that we cut that to 10 minutes. There are two, how many microphones do we have in the aisle? You have heard a lot of information from Minister Tufton about what we're doing to control the NCDs in Jamaica. You have heard from Dr. Bruce about the significant investments in improving diagnostics and interventions, from Dr. Thompson on the role of the food industry and menu labeling and so on, from Dr. Clark on the tremendous work being done by HELP and the opportunities he thinks to streamline the 200 medical missions. And of course, Dr. Jones shared some disruptive thoughts, 10 ideas on how we can improve healthcare management. Lots of food for thought. We will not be able to cover everything in this session, but we're going to keep this to 10 minutes, and we're going to use that microphone. Please introduce yourself and keep the questions as tight as possible. On Twitter, you used to use 140 characters, so please come with some Twitter questions. Thank you very much.
Good morning, my name is Dr. Jarrett and I'm from the Jarrett Foundation in the UK. My question is to Dr. Tufton. You said that you would welcome initiatives or we could bring training to help build capacity of staff. Well, I'm associated with a medical firm and they travel the world and they teach doctors and radiologists and interventional radiologists how to do amazing techniques regarding fibroids, because 7 out of 10 black women suffer with fibroids, and they are willing to come to Jamaica to train doctors, and they will do it for free. They've just finished a mission to Kenya, and they've been training doctors there, and those doctors now are training other doctors. And I would just like to know if I could bring it to Jamaica, how would I go about it?
You want to ask a couple of questions and then take a few at a time? I'll respond, thanks.
Next, please say your name.
This is really for Mr. Tufton. Good morning. My name is Sharon Morrison. I'm from Julie Maggio Children's Hospital, and I just want to say, Dr. Tufton, hi, how are you? I bring you greetings from Commissioner Harrington and the leadership team of Julie Maggio, and to let you know that we are ready to grant. Julie Maggio President grant with your group here.
Jamaica?
Yeah, with the Jamaican
moves.
Right, so we can run. That's what I just said.
Thank you very much. Thank you very much. Excellent.
So this morning, my name is Maxine Elliott. I'm the Director of Health Information Technology with the company Omni Systems. We're located in McLean, Virginia. I'm actually in the Atlanta office, and we've recently launched a Jamaica office. Dr. Tufton, you may remember at the last Diaspora conference, I tracked you down, and we've started some great conversations in the different sessions then, and since then we have taken some of the challenges that we discussed at the last conference. One of them was training in workforce development. Omni Systems is, and now as a Jamaican entity, we have strategically positioned ourselves with local partners in Jamaica to be able to offer to the Ministry of Health virtual reality gaming technology and robotics-based learning management solutions that are specific for the healthcare sector. In addition to that, we offer 18 accreditation programs around information security and data privacy. I know that the ministry here has close networks with the NHS in England. We're currently working with NHS Digital, and as you move towards this digital landscape for the healthcare industry, we would like to know how you would be open to having that discussion to ensure that not just the technologies that are put in place, but the security platform around those technologies to keep at its lowest risk potential instances like the WannaCry event that happened in the UK from occurring in Jamaica. But there is one challenge-based question that I do want to put to you.
I've heard a question there.
Okay.
So could you keep the second question very tight?
I will do.
Please.
I will do.
Yeah, because we got the line behind.
Right, okay. One other thing is, as a registered entity, an entity that is constantly striving to work with Jamaica in many different ways, how would we, or what would you suggest is an improved strategy to engage outside of the usual procurement there's one challenging thing that we have encountered, and that is...
I think we got that.
There is one moment, please. There is one challenge that we have encountered, and I would like your advice on this. I'm sure it's going to be the elephant in the room for others as well. And that is, how do we position ourselves to stay ahead of engagement with other countries, such as the Chinese, to make sure, as the diaspora members, that we have an equal opportunity to work with ministries such as yours.
Thank you very much. All right, will you take one more?
Might as well just stand up there. If possible, I'd like to get two more, but I will let you.
Question from this side.
Well, let me get from this side and then you don't mind my roaming a little bit.
Yeah.
Good morning, Minister Tufton and fellow panelists. I am Dr. Anna K. Harvey, Medical Officer.
Sorry, Dr. Harvey, before you start, I'm going to ask all the persons in the queue, when posing your questions, please leave out the prefix. Right? Please go straight to the questions. If you look behind you in the queues are long, however short period of time. So please do the questions.
Challenges. Yeah, just go straight to the questions, no speeches.
Okay.
That's what he said. Diplomatically.
Alright, I work in the dermatology clinic for the Southeast Regional Health Authority. Our biggest issue is transportation with our patients from St. Anne. We see patients from Mandeville as well, and they're dirt broke. So, what about, I may have missed it earlier, but mobilizing us to see those patients with the mobile units, you know, still biopsies and administer care for those patients.
Something tells me enough for the diaspora. Do you work here? All right, fine. Can I just answer the first two questions? The first two questions are on missions. It starts with a project proposal. So if you have the first person who spoke ask about bringing their persons here to train, once you send us a proposal giving that kind of assistance or offering that kind of assistance, I redirect it to my Wellness Foundation, who in turn will direct it to the appropriate hospital. CAL drives a very active research program at University Hospital in the West Indies. It's a great place to start because they represent the tertiary level, they train as well as provide medical services. So send me the proposal with a contact, and I promise I'll get back to you eventually. And the other issues around, eventually meaning very short.
He's promising to respond.
Anybody who knows me know I get back to them quickly. And the other issue of you raised something about the Chinese and all of that. I mean, we have a procurement process that is guided, that is in law, and we have to follow that process. And as it relates to medical services, whether it's equipment or otherwise, that procurement process has to hold. There is another approach about the unsolicited proposal, but it's subject to what we call a Swiss challenge, meaning that if you put a proposal that's original, that's unsolicited, we may have to advertise it for others to similarly compete. And that's just a standard operating procedure. But many people get ahead by doing it. If you're competitive and you have the ideas, then you will be considered seriously. On the issue of transportation, we have to talk about that all year. We just have to, I need to know what the specifics are. We have many transportation fleets in the public health system. If there is a specific one related to you and a particular procedure, then we can have a discussion on it.
So, Minister, may I take,
oh, yeah,
I'm going to take 3 questions from this side and 2 from that side, so 5. All right.
I just want to ask, can I make a comment instead of asking a question?
Brief.
I would just like to share a success story that will give the audience an idea of what we can do to help the health system in Jamaica. And the reason I'm saying that, Minister spoke about the partnership and get the help here. We recently had a group from the Diaspora who met with a major medical center in New York, the Montefiore Medical Center. And the organization is, the group is called Organization for International Development. I'll cut the story short, but out of that, For the University Hospital West Indies, there were 10 open heart surgeries. It was successfully done, and persons did not have to pay. So I just wanted to bring that to the floor to show that what we can do by reaching out to our institutions abroad to help Jamaica.
Thank you very much.
Good morning. Mr. Tufton, I heard you talk about the data on NCDs, but you didn't mention I, and I is a very chronic problem we have here. I'm part of Health Jamaica Commission. I did the data. So 51% of people who receive have eye problem.
What's the question, sir?
My body about it. How could we save ourselves getting to? We have the data, so we'll have to reach out there to actually start the process in terms of integration and collaboration.
Thank you. Thank you very much.
Good morning. Good morning, Dr. My name is Anthony Ross. I heard you talk about people getting older. I started a company called Ross Amazing Home Care just for that purpose. People will stay in their own home and someone will go. A lot of nurses are trained here in Jamaica who can assist them in it. We talk about people who comes to this country with wheelchair and all kind of thing. We can use that also in tourism.
Is there a question?
So, how can you help me to get that out to the public?
Moderator just prompted you to ask a question. But I agree with you in terms of the demand for aging population. In fact, I think it's the next big industry in Jamaica, and we need to leverage tourism, assisted living facilities, where persons can be engaged, can be supported, and they can enjoy the facilities in the country. So I think we should see some creative, innovative concepts and proposals coming forward. We have to do a couple of things to make it work. We need a proper healthcare system. You can't be building an industry for aging population and not good hospitals, because people need that kind of service. That's just the nature of that life, that cycle. And the issue of wheelchairs and the more sort of mundane issues, the Health and Wellness Foundation does a lot of that. We give out a lot of those things. So if you need further advice, where's Cephas? He's right here, that gentleman. He will give you whatever information you need. Thank you.
Please do me a favor. Answer me when I tweet you, okay?
It's hard, it's hard.
He gets a lot of
I'll try.
Two questions from that side.
How you doing? Thank you all for the time and for all the information. My name is Stephon Grant. I'm an entrepreneur in the tech, tourism space and stuff like that. And I have a question on, I know you guys are speaking about innovation and sustainability and stuff like that, but in my consulting base, I want to let you guys know as well to ask a question. One of the things that Jamaica has popularized, and I sincerely respect all of our elders and everything like that, but I know this can be a bit taboo, but what Jamaican culture has done has popularized cannabis and medical cannabis and all those things like that. But correct me if I'm wrong, I don't remember hearing about that in any of your slides or information, but when you speak about health tourism and Jamaican culture, cannabis is a multi-billion-dollar, trillion-dollar industry. So have you all considered how we can integrate health tourism and not just the psychoactive parts of cannabis, but the real CBD health benefits which have been verified actually across all organizations? How can we implement that in the culture to bring more tourism while at the same time sustaining the health industry and even taking extra money to donate to the community and other things like that? How do we make that happen?
Thank you very much.
You know, the cannabis industry could take a long discussion. Yeah. And I have my views on it, very strong views, and some you may not find pleasing. But from a public health perspective, I think there's great potential in medicinal cannabis. So whether it's THC or CBD, so it's about extracting from the plant itself. From a smoking consumption perspective, Jamaica has a major issue with abuse and use of cannabis in its natural form, and it is a significant issue in the public health system. I think we have gone about it wrong, and probably shouldn't say that, but I think we have gone about it and created more challenges for ourselves. In that I think, in countries where cannabis industry has done very well, it resides in the Ministry of Health, like in Israel or Canada, in Jamaica is in the Ministry of Industry, Investment and Commerce, which requires a lot more coordination, I think. Having said that, I think both myself and the Minister are trying our best to make the industry work. Part of the globalization of the industry is outside of our control. It's based on the global financial system. You have to watch America to see what they do. Once they free up the money flow, the industry does well. It does well in states of America. But states, the federal government, once you start trading and exchanging money, then they shut down the banking system, or that's the threat. So we have to manage that very carefully. But I do think there's opportunities for research, for extraction, and I do think we grow some of the best herbs in the world.
Minister, regrettably, we have time for only 2 more questions. So one from that line and the gentleman.
My name is Hillary Burrell. I'm a retired registered nurse with over 54 years experience in training right here in Jamaica. I have another question, but I'm talking to Dr. Clark for Jamaica. My mission, I have a mission that I coordinate for the last 16 years, and every year we have given 1 week of voluntary service, and we work in the parish of St. Catherine. We collaborate with the Ministry of Health and the Health Life and Wellness Foundation, and we bring in doctors, nurses, pharmacists, a complete team, and our team is 16 to 20. So I would like to talk with Dr. Clark to just tell him a little bit about our food and things like that. We treat the patient, we give them the medicine, and all that. One of our doctors are right here with us today, Dr. Clark, who has been coming for 16 years with me.
Great.
So there's a lot of things I can offer.
Great job. I applaud you, and we can speak about it
We
after
were
this.
Old Harbor Bay a few weeks ago where Mr. Tufton was there also addressing us.
All right, great job. Thank you.
Okay, I'm really apologize to the other persons who are in the queues, but this has to be the last question. Sir.
Good morning. Dr. Tufton, I am Dr. Howard Harvey. The question I want to ask you is that I remember you making a presentation on mental health, healthcare presentation. Is there a reason why? Also, I would like to show it out that I'm not hearing much of the chapters having anything to do with mental health care and as a concern for us. Because the healthcare system doesn't just flow on its own like that. It also affects us mentally. When somebody is ill, it affects family mentally as well as psychologically.
Okay. So thanks for that. And for those who didn't ask questions, you can catch me on the way out just in case you need to talk about briefly. On the mental health issue, I did mention it actually. In fact, the wellness addition to the ministry, which I define as a state of mind, is a very, very mental thing. But beyond that, more specific to mental health, I didn't have the time, but we did do a mental illness and homelessness task force report, which was released a year ago. Dr. Wright from UWI had commissioned it, which outlined the state of mental illness in the country, which among other things show that 4 out of every 10 Jamaicans at some point in their lives experience some sort of mental instability. And by the way, globally that trend is similar and growing. So it's a big issue, which is why it's part of the 3-pillar expansion of UWI, mental illness, research. There's also a series of recommendations around mental illness that we're trying to implement. I think starting point is destigmatization. There is a perception that people who are mentally challenged are mad people, quote unquote, and they should be ostracized, be outcast, which is why homelessness is such a big part of mental illness. So we're going to be launching a public education program to show that mental illness affects the floor as well as the boardroom. There are different varieties and types, and the consequences are the same. You must learn to recognize it, and it can be treated. And then, of course, we're adding a lot of infrastructure. The global trend now is community-based support as opposed to institutionalization. So looking at Bellevue Hospital, what we do with it, getting more community-based support through mental health practitioners, mental health aides, more logistic support, all part of a grand plan that we're working on. So yes, it is a big feature of the program. Thank you.
Thank you very much.
Mr. Moderator, we have our Millennium been here all week.
I'm sorry.
One question on Millennium.
I'm so sorry. The minister and the presenters will be here. We'll be available to you after, but there's another session that's due to start at 11. We really have to be more disciplined. Thank you. They will be available to us. Thank you very much. We want to thank Minister Christopher and our presenters, Dr. Carl Bruce, Dr. Sylvanus Thompson, Dr. Robert Clark, and Dr. Oliver Jones. They shared some rich information with us this morning about health and wellness, a healthy population, a healthy nation. I think we want to thank you for your time. I think there are some baskets to be presented to Dr. Tufton and our panelists.
Also, ladies and gentlemen, we're going to open the marketplace in less than a minute or so. So we're asking you all to support that. Additionally, I want you to go and visit each of the booths, especially at the top of the stairs right beside the canteen. There is a wonderful, or the dining room I should say, there's a wonderful, wonderful display by our local economic initiatives, our community groups, and they have a lot of products on display that you need to go and support. That is from the Social Development Commission. And apart from that, there are other businesses that are up there, so I want you to go check it out. You can buy it enough and put it in your bags and stuff, and you can carry it back. So all of that you can do. Additionally, I want you to go and visit the Farm Up JA desk where you can register for the 3K walk and run. That is Thursday morning right before the Diaspora Day of Service projects. So go and visit that booth to sign up. So right now, we're going to open the marketplace with our ministers and our legacy partners, all of our delegates, and of course your supporters, our diasporans, to officially open the marketplace.
Need a lady up there, right?
Please remember to visit our local economic initiatives. And of course, our marketplace, the official opening is right now with all of our legacy partners, all of our exhibitors, of course with our ministers that are present. We have Dr. Tufton, and of course we have Senator Johnson Smith, who is waiting to officially open the marketplace. And again, I want you to sign up for the 3K walk and run. I'm certain that Dr. Tufton will be there. I'm certain that Dr. Tufton will be supporting the 3K walk and run, courtesy of Farm Up, sponsored by Jamaica National Group.
No doctor female, doctor male. What the hell? Right? No doctor male. Okay, you call him out. No, but I like you calling him out. That was good. But it's so true, man.
So remember, ladies and gentlemen, we are now going to open the marketplace. Remember to sign up for the 3K walk and run, you can visit their booth that is at the entrance of the Jamaica Conference Center. And that will be Thursday morning. 3K walk and run. Sponsored by Jamaica National, the Ministry of Foreign Affairs and Foreign Trade. Remember to visit all of our exhibitors, especially our local economic initiatives, and that can be found right beside the top dining room. You can get your nice castor oils, your jewelry, all of that and so much more. You can get it right upstairs. And I want you to go and support and visit the booth. We have all of our legacy sponsors, Jamaica National.